Hello, dear doctors. It is all about temporomandibular joint disorders. What is the treatment of choice that we generally follow in our practice to treat temporomandibular joint patients? We all know it is the splint. I work in a hospital and deal with a lot of temporomandibular joint and orofacial pain patients. And of course, many of my patients do get well with the application of a splint. But then there is another set of patients or another category of patients who does not respond to the splint, or even some of the patients get a flare up of pain due to the splints. There's another set of patients who get a little improvement, but then they're not happy with the results. Have you all come across such a scenario in your practice? Or do you refer the cases to another specialist or a dentist who knows little or a little about temporomandibular joint disorders? How do we manage these cases? Later, I realized that the temporomandibular joint pain can arise from within the joint, where you have the disc, or it can arise from the joint itself, the articulating surface, or it could be due to joint effusion or some fluid collection within the joint. It can be an arthritis, osteoarthritis, a rheumatoid arthritis, osteoporosis. A number of conditions can cause a problem within the joint. Number two, there's another scenario where the muscles attached to the temporomandibular joint or the muscles of mastication itself can radiate pain to the temporomandibular joint. It can be myalgia or myofascial pain or any other diffuse pain that can cause a pain to the temporomandibular joint. Do we think every etiology has the same treatment plan? No. For certain things, of course, a splint does work, but then there are other conditions which we need other modalities of treatment. Sometimes a multimodality treatment will give a maximum efficacy to the treatment of the temporomandibular joint disorder patients for their betterment. There are another set of cases where TMJ pain will be mimicked. The pain will be mimicked as a temporomandibular joint pain. For example, I can say a temporal arthritis or a mastoiditis, or even due to bruxism, the pain, or even obstructive sleep apnea patients have temporomandibular joint pain in the morning. Or it can even be due to a facial migraine or some of the neuropathic or neurovascular painful conditions. Everything has a possibility to mimic as a temporomandibular joint disorders. If we don't have the diligence to delineate these conditions, we treat these patients with just the splints alone and get ourselves into the troubles. Every new year, we take some resolutions to make our life better. Let us take this new year as an opportunity to learn something new and enrich our practice, incorporate a new specialty into our practice, and do something betterment for the patients. Have the wisdom to learn something new in the year 2024. Come join us for a program on temporomandibular joint disorders and orofacial pain in Kerala in Feb 24 and 25. Thank you.